So this is teaching and testing the new BLS exams. I'm Dan Limmer from Limmer Education. I'd like to welcome you all here. We have a big group watching this live. And for those of you that watch this later recorded, I'll welcome you as well. The purpose of this session is to go beyond what the National Registry has told you. The National Registry's wheelhouse is the testing part. They've had a couple webinars about the new BLS exam itself, some question and answer about that. We want to take it a little bit farther today. We want to go into not only a little bit about the exam, I'll recap some of that stuff, but I want to now take it and bring it into the classroom. I want to look at the realities. I want to go a little bit deeper. I'm not the National Registry. I can give you some opinions on certain things, and that's what we're going to do today. So in this, a lot of you have seen the chat, the webinar chat. I'm keeping a look at that on my screen. I'll try and catch questions as they go by. So it's time to get started and to do this. So that's it. So don't forget about the chat. Teaching and testing the new BLS exams. Again, I am Dan Limmer from Limmer Education. All right. So, I think we have a little bit of okay, here we go again feeling. Last July, they changed the advanced exams. And in doing that, that was a little traumatic. It was a little different, especially with the types of questions, the clinical judgment scenarios. There's changes to the BLS exam. I don't want to get too far ahead of myself, but I want to say, yes, there's changes, but I don't know exactly how the changes are going to be. We'll really know that when we get out. And this takes place August 7th. So really about a month from now. A month from now to the day, the registry is going to shut down the exam for a couple of days. First time that's happened. And then they'll restart on April 7th with these brand new BLS exams. Now, I'll talk primarily about EMT. EMR is affected by this, just for the record. EMR is a relatively small amount, and I think most people here are really thinking about that EMT exam. So as we go on, I'm going to organize this by some big questions. I think these are the big questions that I've found that most people have when we talk about this. So how much does the exam change? What are the changes to the exam? What about what we teach? How does it affect what we teach? How does it affect what we test in our EMT classes? And then how do I prepare students, right? So the first couple parts is like the National Registry's talked about. We're going to talk about that a little bit. But how you teach, how you test, how you prepare your class, that's more our wheelhouse. Limmer Education has always been here giving you exercises and things that you can do to help get ready for this. And we're going to continue that. We've led with the ALS exams as far as the first out and continuing to be strong with our TEI and multiple response questions, clinical judgment scenarios. It's our intent to do that same thing for the BLS exam. So let's get into some of these questions. So how much does the exam change? Now, there's a little bit of this that we're going to have to be a little careful about because we'll have to see when it comes out. We always wonder about pass rates and how it's going to go. But if we look at some of the details, if you listen to the National Registry's webinar, Paul did a couple webinars with Kenny coming in and being there and talking a lot about the exam. They did a practice analysis. I think they did it a little bit differently this time. The registry used to survey thousands of people. This time, the focus groups, they brought people in to say, ultimately, what does a practice analysis do? It says, what does an EMT really do, and how do we test that effectively? And it's designed to reflect the practice of BLS providers. Now, as I go through these slides, I will admit there's times I have a little head scratching when it goes to this about the percentages and other things. But let's get into this and let's see what it really means. I think it's really important to have a certain amount of faith in the National Registry as the exam organization and what they do. Right? I think that's important. I think it's also important not to overreact. Change is difficult. So let's go on with this. Now, we were so used to the old exam, which you see kind of in the right side of the shaded part of your screen. airway, ventilation, respiration, medical emergencies and OB, cardiology and resuscitation, trauma emergencies and ops were kind of like our old friends. As a matter of fact, we really didn't like it when they took those away from the score reporting, even though I really don't think they were very valuable. The psychometrics that the National Registry uses is so advanced. I think those categories became a little bit obsolete because of the way they can really go through and work questions. And we know a question may have some airway and some assessment and some other stuff in it as well. Not to mention the fact that the exam, the second time you take it, is totally different. So it's okay that they went away. But what are they replaced with now? Well, a very assessment-based exam. Scene size up, primary assessment, secondary assessment, patient treatment and transport, and operations. Now, as you look at these, this is a little bit where the head scratching comes in. All right. I see scene size up, safety. Okay. Primary assessment, really important, life threats. I get that. 5 to 9% secondary assessment isn't ringing totally true with me, and that's not a secret. Other people have said that. Patient treatment and transport, 20 to 24%. I'm good with that. Operations, exactly the same as it was before. Now, operations, remember, is a little bit of the front of the book and the back of the book. Well-being and medical legal is MCI, triage, and other things as well. Matt, TEI is a technology-enhanced item. Drag and drop, multiple response, all those new questions the registry's doing. I'm keeping an eye on the chat there. So let me say a couple things about this. I don't have an issue with a strong assessment focus. I've believed in assessment for a long time. I also believe that when we make errors, like in giving a medication, they're more assessment-based, they're more thinking-based than they are reaching and getting the wrong medication or giving too much or too little. We blow the diagnosis more than we make an error giving a med. And at the EMT level, I think fostering that thinking is really important. I put a TikTok up yesterday where I asked EMTs what was in their scope, what medications. Diphenhydramine, Zofran, acetaminophen. I mean, the things that are now popping into the EMT's toolbox is pretty dramatic. And that's on top of the NEBs and the CPAP and sometimes nitrous and other things that people have. How do we make those decisions? Well, we make them based on assessment. Years and years ago, Mistovich and I were in a bar in Salt Lake City, which is probably where all good jokes probably start. And we were saying, there's a trauma class and there's a pediatric class and there's a geriatrics class. Why is there no medical emergencies class? And Susan Katz, our publisher there, and says, you should write a book. And that's where AMLS was born, Advanced Medical Life Support, in that conversation. And we're fortunate to bring in Twink Dalton and Howie Werman, who's an amazing team. And as the book developed, we realized that about 80% of the content of that book, when we wrote it anyways, was assessment focused. Only 20% was treatment focused. And that's because if you do assessment and good differential diagnosis, you're going to pick the right protocol, right? Because we're protocol driven. And this is why I'm really good on assessment. Just for the record, I want to say I get that. Now, do I think the differential diagnosis and some of the secondary assessment stuff is going to be represented? We're going to have to wait and see. But the way that these domains, each one of these is a domain, the way they're divided up doesn't fit our traditional skill sheet pattern, right? So I think we're going to find, as we go through this and say, what are the changes in the exam? We're going to find that we're going to get a lot of the same stuff, just put into different categories. So let's talk about that a little bit itself. Because on webinars that Paul has done for the Registry, Paul Rosenberger, there's great webinars. And I was fortunate to have a personal conversation. After the first webinar, I had lots of questions, and the registry's always been very straightforward, very good. And I talked to him probably for half an hour answering my questions. And a lot of the questions are going to stay the same, right? The same questions are there. The National Registry didn't take and throw out thousands and thousands of questions and write thousands and thousands of new questions. Now, there are new questions with the patient assessment focus, but all the other ones are going to be in there, and they're going to be organized differently. So while the percentage of the content may tweak, I want you to remember that what fits into those categories may be a little bit different. Now, TEIs, the EMT exam, I think largely were pilot items. I think a lot of the multiple response were probably fair game. But any of you who saw TikToks and read blog posts, I went back and took the registry again in January, just because I'm a nerd. It was so much fun, and you learn so much by doing it. I was really, as an educator, I'm like, wow, that's a great question. I wish I could write this down. Yes, a nerd. And my national registry exam, just by my estimate, was 25 to 30% multiple response items. And in the last webinar, the National Registry said they're easier to write. They're out there. They're a good question. So I would expect our EMTs to get a lot more multiple response items, and the TEIs are going to count. Remembering, like with the other ones, the National Registry does not give partial credit for that. All right. And again, we have the mindset and fear. In this, I don't want you to freak out. I don't think it's going to be all that much different. Proportions, maybe. Content-wise, I don't think so. What we're teaching EMTs doesn't change because of this, right? But it did come up kind of, the first webinar was in December, the next webinar is in January. But people that start their course, if you're on a semester schedule in January, are going to be testing in May or June. So we started teaching and an exam changed in the middle. And that does make it a little challenging. But again, I don't believe that there's a reason there to freak out. Let me just check the chat, make sure I didn't miss anything. Okay, good. So let's take a look at some questions. Let's take a look at this, because I went through, and no surprise, Limmer Education has apps. So we have a lot of questions. And I went through and I wrote 100 new assessment questions and TEIs, multiple response, to go in our exams in our EMT Review Plus app. And I categorized all 600 of those questions, right? So, I mean, I had categories coming out my ears for doing this, but it was a really interesting experience. So we had 5 domains before: airway, medical, trauma, cardiac, and operations, right? We had those, that was what it was. And within those sections, in the clinical sections, the questions were generally based on pathophysiology, assessment, and management. So if you had airway, it could be airway assessment, airway pathophys, airway management, and then we throw in some pediatrics in there, right? So you could have a pediatric airway management question. And that was kind of the way the registry would put questions together, take item writing things, you'd be assigned based on those categories. Well, those are gone now, because now patient assessment has their own domains, and treatment and transport has their own domains. I still think pathophysiology questions will be there, especially in things like identifying shock in the primary assessment and relating skin color to the underlying physiology. I think it'll still be there. But we've got 5 domains again. But half the exam has got that assessment focus. And no one really knows what that's going to look like until April 7th comes around. But I think it's worth noting this, and we're going to spend some time at the end of this webinar getting ready to have you teach better assessment and better things. The estimate from the National Registry was about 10% pediatric questions. That's down a little bit if that stays true, but they did use the word about, so I'm not looking to necessarily hold them to that, but you should still be looking at pediatrics. Remember, pediatrics now is moved throughout the entire education standards, and as Dr. Antevi says, Peter Antevi is a brilliant man, great teacher, an advocate. Let's not make them scary and put them off to the side. Get your pediatric stuff in there. So I'm just going to look at the chat. AMLS integrated into the medic program before the first text came out. Yeah, that was back in the 90s, and doing that should be integrating it into EMT and AEMT courses now. You know what? Some of the concepts in there, differential diagnosis that we did in AMLS, the concept of possibilities to probabilities, you certainly can teach right now and grab some of those things. And we're going to talk about how that fits into the registry exam as well, Andrew. So let's look at a question. All right. An 11-year-old fell from a tree onto the rails of a fence. They complain of abdominal pain, but are ambulatory and otherwise uninjured. Vital signs are pulse of 118, respirations are 24, blood pressure is 110/74. You should suspect. All right. Classic registry, you should suspect. We're going to talk about how this all fits in. So you have choices. So the pulse is kind of high, respirations are high, blood pressure, the kid's, he's a little older, but he's got a healthy circulatory system. So he's got internal bleeding and compensated shock. Now, I think that in the old registry, this would be a trauma question, pediatric, and it's about assessment. You should suspect. That's a diagnosis question. And boy, does it make people mad. I wind people up on TikTok all the time when we talk about diagnosis. The EMTs don't diagnose. Of course they diagnose. A field diagnosis is actually even in the education standards at the EMT level, or presumptive diagnosis. I mean, it's in the standards. So just so you know. Now, I'm thinking it's pediatric and it's probably primary assessment. Now, this is where the smoke starts to come out our ears, because we say, wait, primary assessment, there's vital signs in there, right? The thing is, those vital signs wouldn't be done in the primary assessment. This would be a secondary assessment question. But when we look at some of the tasks that are in the primary assessment, I'm going to go over those in a little bit. This is a question I probably would tag into primary assessment, because you're looking to identify shock. I think we need to get the skill set mentality out of our head when we do this stuff and focus on thinking as it goes. Let's do another question. 53-year-old complains of chest pain and trouble breathing. Yeah, otherwise uninjured. Yeah, that's the thing. There's no other injuries. It's isolated in his belly. He doesn't have anything else. 53-year-old complains of chest pain and trouble breathing while driving a bus. The patient's skin is cyanotic. You auscultate inspiratory rails. They take nitroglycerin and an inhaler for a bad heart and bad lungs. They deny other medical complaints. You should first. This is a cardiac question, and it has to do with management. Now, yeah, aspirin. Yep, you got in there. Good. Aspirin is, people are taking the questions. That's good. But is this primary assessment, right? You have history in there, but what should you do? In this, the aspirin is done so early in the call. If I were looking at where I'm going to put this, now this could also go, to be fair, in patient treatment and transport. What it comes down to is how early this is done in the call, right? And think about how we teach, right? Aspirin. Well, if you teach your students you can't give any medication without vital signs, you're messing them up, because aspirin you can. You allergic to aspirin? Any bleeds? No? Okay, why don't you chew these aspirin? Emergency medical dispatchers give aspirin while we're on the way. We should get that aspirin on early. And that's why I switched this to the primary assessment, right? You can give it without a blood pressure. It doesn't affect hemodynamics at all, and it can be very beneficial. So in this one, I said, because it's so early in the call, I pushed it towards primary assessment. So it would have been a management or a treatment question before. Now we're plugging it in a little bit differently. So let's do one more. 17-year-old has been shot in the chest. Oh, I hate when that happens. The patient's unconscious. The bullet wound is bleeding. You should first. Well, this would have been a trauma and management. But again, we're back into primary assessment. So see how we're shifting away when you're doing exam preparation. Now, I don't think your exams in class should change, right? This question is going to be on your trauma exam. You don't have to change the names of your exams. But I think when you start doing exam preparation, you start making, let's say that you've got some great questions, right? And you're making a practice test for your students to just show them what the registry is going to be like. I think you'll look at those a little bit differently and probably have a little bit more assessment in those questions, right? I think that's really important. But I just wanted to show 3 questions and show how they're tagged. And now, if we look at this, does this change anything that we teach? Now, all right, Matthew puts them up here, and I'm going to address this. That's primary assessment. Vital signs like the heart rate and BP, I don't think are in a primary assessment. Matthew, everybody would agree with you, right? Because we're so focused on skill sheets. I'm going to give you 2 things that I think are going to maybe counter that a little. One will be the tasks. The National Registry has kind of pushed those vital signs a little bit up into primary assessment when they're making the things. The other thing is, a lot of times if we drop the skill sheet focus and consider things like, I'm talking to my patient, I'm saying, hey, how you doing? I'm feeling their skin color, temperature, condition, I'm checking their pulse. Maybe somebody else is getting a blood pressure on the other side. Things tend to blend together more. I don't think skill sheets are our friends. We got to get people to go through and do things, but we rely on them too far in the class. And that hurts us when it comes to answering these questions. So I think it's that, no, we're not, Braylon. We're the registry where they put the questions in, but I don't think it changes practice. And this is part of the dilemma. Let me go on a little bit. I'll show you. So do we change what we teach? No, no. The education standards haven't changed. Do I think we need to be less rigid as we mature? Yes. Those questions like, well, vital signs aren't part of the, I think we have to be more flexible. And we have a handout called Guiding Principles of Patient Assessment. And maybe we can take that, and we have posters for your walls in your classroom too, if you want. Maybe we could put a link to that article in the chat, because guiding principles of patient assessment are better than skill sheets, right? What are the guiding principles? It's not that you can't do blood pressure in the primary assessment. It's that you shouldn't be doing a blood pressure if you should be saving their life first. And there's a difference to that. So now let's look at the domains. Scene size up has all the traditional stuff in there. Now, the National Registry did their practice analysis, and they said, okay, we got these 5 things. These are the categories. We think these are what EMTs do. And in each one of those categories, they have tasks. And in a minute, you're going to get a link and a QR code. And we've interpreted those and put them all together in a document for you. Traditional scene size up stuff is there, but triage seems to be added there as well, right? So these are some of the little differences you'll see. So in scene size up, in the tasks, they bring in some triage. Now, do we have to teach it there? No, they haven't even learned anything about sick people, just starting in scene size up. That'll probably still be more in operations, but bring up the concepts of triage to make a difference. Now, primary assessment. This is the part, it contains the traditional primary assessment content, but here's the task that's put in. This is from the practice analysis from the National Registry. This is not mine. The first line is the task. And then in the document I'm going to show you, we actually put in the parts of the education standards that match the tasks. Obtain the results of patients' baseline vital signs and diagnostic testing. That's part of the primary. Now, in here, in my heart and in my head as an EMS educator for 40 years, does it sometimes want to make my head explode? Yeah. Does it mean anything big other than how they're going to categorize questions? Probably not. As a matter of fact, what that does, obtain results of patients' baseline vital signs and diagnostic testing. If we're interpreting those, it's going to mean primary assessment, which is going to be about 40% of the exam, is going to get a lot of the old questions put in it. So what does it mean? Same questions, put in a different place. Let's not freak out about it because it goes against something that we're used to doing. Let's keep that and go on. Now, the funny part, though, is secondary assessment. Look at the little green sliver there. That's it. Secondary assessment and reassessment, 5 to 9%. Like I said, size up, primary assessment, you've got criticality and frequency both. I get we're going to do a lot of those. But in something where the registry is going to ask questions like you should suspect with a diagnosis, you'd think secondary assessment, more history and physical exam, and you have vital signs again, would make a difference. And even reassessment, seeing trends. It's a relatively small part of the test. And again, let's look at it in perspective. Primary assessment, figure 40+%. Seen size up, we'll round that and just go in the middle, 17%. We're looking at over half the exam just on that. But because of the way the tasks are in there, I think we're going to see a lot of the old, questions in there. I have to take a quick look at the chat here and see what's going on. Yeah, I think skill sheets have a place in our initial learning. I just think that they're a crutch. I think students get out and they can't do anything other than sample and order, and patients do C-LAMP and Malplas and, don't do sample and order. And when I teach assessment, I'm like, the best history question you can ask gives you two more questions. It's a path. And mnemonics and skill sheets don't take you on a thinking path. They take you on a procedural path. I think we start with them if you want to go through the steps and then give scenarios. I'm going to talk about that in a little bit. So this all comes together. I anticipated this. And maybe this is why the registry doesn't get into all of this stuff in the exam. And how about actually categorizing questions? I've been up to my eyeballs in categorizing questions, right? So I think to a great extent, I want to try and give you a little bit of background there where I can. All right, so there is a QR code that you can do here, and with perfect timing, now in the chat is a clickable link. This BLS exam quick reference, what it does is it takes each of the domains and puts in the tasks from the task analysis. And I went through and gave a little bit of an editorial comment for each of those, how I think they should be interpreted and applied in the classroom. So if you want to see this, you want to get it all in one place with some insights, with links to the parts of the education standards that are taught in each of those tasks, there it is. It's our job to prepare you for these things. Click on that link. If you're watching this now and you're a QR code person, or if you're watching this and it recorded some other time later, you can just get that QR code. It's going to get you what you need. So, well, I think, Robert, I think at the EMT level, the exam is very varied. It depends state by state. We've done away with psychomotor exams for ALS candidates. And that's because of the paramedic. We have a minimum competency. At the AEMT level, we have a different exam. I would actually double down and say, couldn't we just validate their skills in class? If they can follow the skill sheet, what are we really testing at the end? And the whole concept of the psychomotor exam, the other reason the National Registry got rid of them is because there was no inter-rater reliability. It wasn't a valid assessment. And I think states really have to come down with that. If I was teaching an EMT class, I had my way, I would go through and I would validate people as we go through the class, keep a signed off skill sheet, put it in their folder to show that they were validated. And that essentially was the same as a psychomotor exam. I don't think the pressure of the psychomotor exam does it. I think we lose good people because sometimes people get freaked out about it. But I digress, as we say. That'll get some comments there. All right. So are skill sheets the answer? No, I'll emphasize, no, they're not the answer. And I'm not anti-skill sheet, but I think one of the things that we need to do as we do this to mature and to deal with this exam and is to realize that there's more to that. But I'm going to put my money where my mouth is, and I'm going to tell you why I think that. Because with the National Registry, what they ask is rarely about memorization. And you can memorize a skill sheet. The Army and some other places, they make the armed forces in general. What they do is they have this thing where they have a little drill where one person's the instructor, one person's the student, and they make the skill sheets into a script to memorize the steps. Very effective. Doesn't help people assess patients, but it helps them pass the test, right? But what's the registry really going to ask? What's going to kill them first? What's going to provide the most valuable information? What gives the EMT results, or what's best for the patient, right? We walk in and if somebody's in tripod position, right? And they've got an inhaler sitting on the table. What do we say? Do you have any signs and symptoms? Do you have any allergies? No, we should be able to, through experience in class, say, hey, I see you're having some trouble breathing. You have an inhaler there. What's going on? Open-ended question. And say, okay. And while you're doing that, you're taking the stethoscope off your neck and you're saying, okay, I got to make sure they're breathing deep enough and they're not in failure, primary assessment stuff, look at their skin, whatever. And I'm going to listen to the lungs. I'm going to do something that's valuable rather than rote. And I think that's really important. And it's based on pathophysiology. It's based on understanding, right? I've got poor skin color and it's moist. Well, what makes that happen? Well, we probably have increased our vascular tone and pulled blood away from the skin. That could be shock. It could be hypoglycemia. If we understand pathophysiology, then we understand the signs and symptoms and we look at things differently. And skill sheets don't get us there. They just don't. And they don't prepare us to ask the kind of questions that the National Registry is going to ask. So, does this change what you test going through these questions? Let me see where I am time wise. I'm about halfway through. I think maybe it changes more how you test because I spend a lot of time, we call it talking people off the ledge here at Limmer Education. They go to the registry, their head explodes. Why? Because they haven't ever had a test like that. We give tests. Oh, it was a dark and stormy night, and you're driving your ambulance and you go on. But the National Registry gives you 2 sentences and wants you to make a big conclusion. And those questions are harder to write. They're much more challenging to write. I get that. But we don't always prepare our students for the questions that they are going to get. So I think testing in greater depth, right? My friend Joe Mistovich says, and it's something I repeat to people all the time. I always give credit. If you want your students to learn superficially, test them superficially. You want them to learn comprehensively, test them comprehensively. So shout out to you, Joe. Even though you write a competing book with a funny color, not yellow, I still love you. Style and format, multiple response items. Let's get them in there, right? They're going to see a lot of those. And difficulty levels. We have to make them difficult without having them be ambiguous. So one of the things that Paul Rosenberger said in the last webinar is that, hey, listen, multiple response questions are easier to write than some of the TEI questions. And you're going to see them, you're probably going to see a lot of them. I certainly did in my advanced exam, and I expect that's going to be the case on the EMT exam. A lot of the new questions I've been fed in there, multiple response has been fair game for a while, but I think a lot of the questions I'm guessing that are fed in are going to be like that, TEI, multiple response with an assessment focus. TEI are technology enhanced items, drag and drop boxes that you click on to categorize things, build lists where you put things in order. And those are technology enhanced items. Now I'm going to, just because Julia asked that question, I'm going to go to the bottom bullet here. Students don't have problems with the technology. Students don't have problems with the technology. They have that technology in their hand all day, every day. They can drag and drop and swipe and click radio buttons, and they do it all the time. It's the thinking that goes with those that's the key. Don't get hung up on the technology. Give them practice making those decisions, right? I think that's important. And the multiple response items, to go back to that, they are easier to create. The registry said that in the webinar, and they're easier to integrate into class exams and LMS, and you're pumping up the volume just a little bit more. Now, a question came in. As an instructor, how can I gather feedback on student failures? I want to identify my instructional weaknesses. The registry doesn't give you that report anymore for your students. If somebody fails, you can't have them come in and look at what they passed and failed. And quite frankly, I really don't think that was that valuable anyways. Now, granted, right, Limmer Education, I'm going to say we have apps like EMT Review Plus has 5 120 question exams. We increased the number to 120 because that's the maximum an EMT will get on the registry. Assign them an exam and we'll give diagnostic scoring, not only on these new registry categories, but on the others. And I'll show you how that's done. All right. So yeah, I mean, granted, I'm telling you, this is a Limmer thing, I'll tell you to do, but there are other resources out there that can be used that are not only economical, but they're going to get you something and be dependable. All right. So if you use that EMT Review Plus app, you're going to see 3 different score reports. All right. And I went through and I tagged 600 questions, right? Now there's 120 questions. And you know what else you do? Make sure you tell your students to sit and take some of those exams all at one time. Taking 10 questions and come back doing 20. Students are, attention spans are about this big. they need to have the experience of sitting there and doing 120 questions. That will help them deal with the National Registry if it does go the distance. All right. So, first thing the score report's going to give you is a percentage. Now, we took this app and we're working on all of our apps for that. And now we're giving you an NREMT scoring report. We tagged all those questions: primary assessment, size up, secondary assessment, patient treatment, and transport and operations. Now, in doing this, I'm going to admit I probably have more than 9% of questions in secondary assessment. That's the way it is, but I still think it gives you a good idea. I don't have to match those percentages perfectly, but I think I got them in the categories that are reasonable to expect that the National Registry will do. So your students taking this exam will get this type of scoring report in EMT Review Plus, our app. But wait, there's more. To answer Matthew's question, how do you know what you want to teach? We do 2 separate scoring profiles. Here we're broken down into the traditional modules. We have preparatory, airway, assessment, going in order as the teaching often goes. Preparatory, airway, assessment, medical, broke cardiovascular out. That's the old registry section, and it's a lot. So I broke that out a little bit from there. Trauma emergencies, special populations, EMS operations, and pediatrics. So we'll give you the registry stuff, but if you want to know how the teaching is going and what part the students need to know, because they do dovetail, ultimately, a lot of the same questions are just going into different categories, we're going to give you both of those things. So we're working really hard to give you what you need, Matthew. I mean, you brought up a really good point. How do you know? So this is one of the things we're doing to make that happen. So how do you prepare students? Let me just take a quick look at this. All right. How do I prepare students? Because I think this is kind of like our test question. How do I test students with this? How do I prepare students? Well, I think there's things we probably should have been doing all along. They're going to work for us, right? If we realize that assessment's a foundation of what we do, and being able to choose our protocol, and a little bit of differential diagnosis and doing that, I don't think we need to do much totally new and revolutionary. I think we've got to do what we probably should be doing now, even better. And I think that's a really important concept. The National Registry asks questions in certain ways. You should next, you should first, or you should suspect. I want you just to take a second and say to yourself, and what I am doing in my class, is that going to prepare them to answer these questions? Because lecture doesn't really do that. To some extent, but practice and application helps them do this. You should suspect is diagnosis. You should first, you should next, right? That's the difference. Now let's look at the fact that scenarios and case studies are probably better at getting students to do this if we give them that practice. Interactive lab stations, not just skills, getting people to think, teaching stations and other things, but not lecture. And here's some examples. Skill sheet versus a scenario. Which prepares you better? Because we have someone take a CPR course and they get a card. And then they come to EMT class and they read the cardiac chapter, the resuscitation chapter, and then they do the cardiac arrest management skill sheet. Okay. We say we're done, but we're not, because the National Registry is going to ask them questions like they're running a code. That doesn't get you the you should next, you should first. Questions that are scenario based. Okay, the patient's eyes start to flutter. They move their finger. You've just defibrillated or changed rescuers. Do you check the pulse? Your students are going to answer those questions better if they have practice doing that. So determining criticality in a scenario, right? The registry says you should suspect. It may be diagnosis or it could be identifying criticality. You should suspect. So I think to a great extent, I really want to say we need to get more active. We need to get more scenarios. We need students to get, I'm going to go back 2 slides here. We need students in scenarios and actual practice to be able to answer, you should next, you should first, you should suspect. That comes from doing more than anything. If they've done it, the registry questions won't look as crazy. Okay. Now we have some resources for you, right? There's going to be another link that shows up in your chat, which is going to be some of these exercises, or maybe they're actually in the whole package there. I don't know. I'd have to read the chat to find that out. I think we sometimes miss clinical opportunities. I think we should get our students to get more from clinicals at the EMT level, because quite frankly, they sit around, maybe take some vital signs, they observe, they're going to the ER, they're standing against the wall. Here's an exercise: clinical correlations, stable versus unstable. Give your student 5, copy it 2-sided, give them 5 of these and say, I want you to come back. Oh, right. All the exercises are in the packet, I was just told. All right. So Chris, I'm going to get to that question. Let me finish this one, then I'm going to get to your question. Clinical correlation, stable versus unstable. Copy these 2-sided, put them up in your LMS if you want to. Have students bring back 5 of these from their clinicals. What's it about? Pick a patient they saw, classify them as stable or unstable, basic information, age and sex, the complaint, type of encounter, any notes, and then have them say to you why you believe they were stable or unstable. And I think that's a way that we can make clinicals a little bit more powerful and relevant, that students have to go out and we're making them think about this. Even if it makes them have a conversation with their preceptor they're riding with at the EMT level, defining stable versus unstable. Think about how many decisions we make based on that. Our primary assessment at the end, we have to make some type of decision like that. Our transport decisions, identifying criticality, you should suspect, comes from this. So I think that in that is really important. As far as what minimal score can a student make to pass? In the old exam, and this is a good question for the National Registry, in the old exam, we always thought they had to pass all the sections. Turns out that's not true. When students pass, we don't see what they passed and failed under the old system, right? We only saw the reports of what they were above, borderline, or below, right? The National Registry Psychometrics evaluates this in a way that's different. What we see in those 5 new domains is where they put the questions in. And I don't think that's the same as passing each one of those things. So it's a question we'll have to ask the registry, but I think the way they put questions in based on the practice analysis and what makes them pass, that 950 number, I think there's a lot of ways to get to that 950 number. And I don't know if that's something that we have to worry about. All right, so clinical correlations across the lifespan. Young and old patients can challenge even the most experienced EMS student or provider. Differences in language, perception, sensory input, history. So, circle pediatric or geriatric, using a comparison to an adult patient, explain differences you observed or experienced while you assessed and managed the patient. Assessment, vital signs, medical history and meds, treatment and management, senses and understanding, role of the family, emotions or feelings you experienced. So let's get that 10% pediatrics and all the geriatric stuff that's out there, and let's do it. And you know what? When a student fills this out and brings this back in from a clinical, talk about it, right? And you can make learning points from these things. So, all right. Rapid patient assessment exercise. What this is we give patients a half-hour scenario and the lab station. What I'm proposing here is a little more challenging. let's give them 4 or 5 patients that they only get 5 minutes each with. And I set the patients up for you. Here's a chest pain patient. It could be pneumonia, spontaneous pneumo, or acute coronary syndrome. Respiratory, asthma attack, PE, spontaneous pneumo again, abdominal pain, altered mental status. There's a bunch of stuff it can be. Right? Now, if you've got adjunct faculty, people that you can bring in of different ages, and just set these people in different rooms and have them go and assess all of them and know that there's a time limit, that you got to go and figure out what's important. This rapid patient assessment exercise is in the material that you can get from the link that was posted in the chat or from that QR code. And then secondary assessment, body system exams, right? That's a big part of it. How do I know what to assess in a patient with cardiac or respiratory or altered mental status? For each of the following complaints, list 4 to 5 elements of the patient history or physical exam you'd perform. Make them in order of more important to less important. Abdominal pain, difficulty breathing, headache, fell and hit their head, twisted ankle, stung by a bee, sick baby, 8 to 9-year-old is weak, right? 72-year-old is not themselves. And this gets them thinking about the you should next and the you shoulds when it comes to assessment. And how much of the exam now seems to be flying the assessment flag. I'm going to put that QR code back up there. But yeah, now these are all for you because the National Registry is going to tell you about the test. Our job, my job as an educator, as part of Limmer Education and the company overall, is to help you and your students pass. That's our mission. That's what we do. So coming up with these, just some extra things for your toolbox to put with you what you already use to be able to beef up your assessment. Okay. Now, also, you're going to find a link to download PowerPoint slides. Now, I'm a person that doesn't like PowerPoint slides, right? But there's something that we can do with them that make a difference. I've given you 15 patient presentations for your students to recognize patterns. I'm going to show you a couple of them, right, as we go through this, and then we'll wind down. I'll do any last questions here because we're coming up on that 50-minute mark here. You'll be given a brief 1-sentence patient presentation. From this, determine a likely cause of the patient's condition. 1 sentence. What are we doing with this? We're trying to get our students to identify important information. We're telling them what it is. It's like giving them part of the stem of a National Registry question and having them figure out what's important and what it means. And we're also giving them some mojo because, I can figure that out from 1 sentence, right? A 34-year-old patient was exercising and developed pleuritic chest pain on the left side. All right, 34, exercising, pleuritic chest pain, right? According to some physician references, that's pleuritic chest pain is the most common sign or symptom of a spontaneous pneumothorax. Your patient should look at this and say, 34 isn't a candidate for a heart attack, and they were exercising. That really doesn't make them a candidate for a heart attack. And it's pleuritic pain on one side. Now, I mean, at the left side, just to make it a little bit more tricky. But I'd want your students to work this out and say spontaneous pneumothorax. And then you as the educator can say, wow, would you know what this was? How would you assess? Would you give this patient aspirin? All of those things that we see people when they do things in the field, they're like, what were they thinking? Right? We can start working on it with something as simple as this. Here's another one. 47-year-old. I notice how they don't say male or female anymore. We're following the National Registry's lead on this patient, right? 47-year-old patient's a type 1 diabetic with anxiety and cool, moist skin. All right, that's hypoglycemia, right? So to that, there are 13 more of these. Each one of these has instructor notes in it, built into the PowerPoint. So I not only will give you these things to give to your class, these would be great as you're doing National Registry Review at the end. Maybe you get through the trauma module, go through medical and trauma, and you want to put something up there. You've got 15, 20 minutes before your class is over. You don't want to let them go early because they've been going early too much. Here's a tool that you can use to do that. There's 15 of them here. You can add your own because it's a PowerPoint document. right? But in this, again, with the notes, I give you teaching points to do on each one. You can go through and do that. All right. So here we go again, all our stuff. There's that QR code. And I know the thing has come up in the chat a few times. There we go. You can get that, and you can get all of these resources. Remember, these resources include all the domains with the tasks that the registry has put in those domains. And it's their material. I mean, it's not like we created the tasks. It's from the registry's practice analysis, but we added what part of the education standards go with it. Now, there's some holes in there. There's things you're not going to see. The patient treatment and transport only has like 3 conditions in it, but you have to do patient, treatment and transport for all of the things. So here we go again with this. I'm just looking over these things. West Virginia still requires a state level psychomotor test for paramedics. Wow. Okay. Thanks for sharing that. So we're at this point here. I think that we timed it pretty well. We're 53 minutes into this. Anything more than an hour, my attention span can't take it. I'll tell you that much. So we're good. I'm just going to keep a link out here. Braylin, is there a different link for the PowerPoint? I believe the link for the PowerPoint is in the document, but Limmer Education will magically answer that in the chat. Very generous. Thank you for these resources. No, this is what we do. I'll be really frank. What we want to do is we want you to come to us for help. We want you to come to us, obviously, for apps and products. But we want to lead in this. We want to be people that are telling you about this, that inform you, that provide resources for you. And to do that, to have that credibility. A lot of people are out there selling stuff. A lot of people are doing stuff with test questions that make students feel really good, but don't really prepare them. I promise you, Limmer Education, the stuff that we're doing for you, we use the same things in all of our products to make sure that students get questions that will challenge them. When you use one of our apps, I want students to scratch their head just like they do when they walk out of the National Registry, right? All right. All right, Lynn. Yeah, you're right there. That's really good. High school students. Oh, high school students are so much fun. I miss my high school students so much. 14th edition of my book, Use the Test Bank. Limmer Education created 500 National Registry style questions for Pearson, and they're in the MyLab. What I do is I call them National Registry Lite. There's a second test bank somewhere out there that has questions that were created by us for Pearson, and they're in the MyLab, and they give you better questions than the Test Gen. What the Test Gen does is it gives you the ability to put a question out there for every objective. But you want something that's more, and they are in there. Look in the MyLab for those. Oh, you guys are very, very kind. You're saying lots of very nice things here. You're all welcome, man. I'm very grateful for all this. Like I said, we want to be a resource for you. We want you to come to us, not just to buy apps. We want to be credible. We want to help you. This is a company that is not some big office building company. EMS focused, loves EMS people, wants to serve EMS people and educators. I are one still. Right? I took the National Registry again just because I wanted to be able to know what it was like to do better for you. All right. Like, holy cow. Russa, the EMR program thing, that's a challenge. You can use some EMT things for that, but EMR doesn't go in the depth, and we don't have an EMR product right now. You can use a lot of these exercises, especially the primary assessment stuff and criticality and things like that, because that's really the hallmark what the EMR does in the beginning. It's such a small number of people that are tested in that. I'm sorry that we don't have a product for that. A gentleman and a scholar. Whoa, thank you very much. And all right, I'm looking. Yeah, I'll be at the Texas Educator show. Yeah, Bo, I agree. Taking the exam is an amazing experience. As an educator, well, first of all, if you're an educator, you're going to take the exam, you're as nervous as your students are, right? Here I am, right? We've had this exam company for 12 years. If I ever failed the National Registry, oh, I don't know what I'd do, So I was nervous going in. But it was a great experience. And some of those questions were just amazing. As an educator, I'm like, oh, I was just drooling over the question. It asked so much and so little and was so relevant. It seems like my questions are harder than the National Register test, especially in our EMT, AEMT, and paramedic pass apps. We do make them a little bit more challenging. And that's so students will be pre-freaked out when it comes to the National Register. Wouldn't feel like it's easy. Isn't that the best way to do it? To give students the experience, have them scratch their head, have them come to you as an educator and say, hey, that app you got us, there's questions in there that don't match what you said, and then you get to explain it, right? The National Registry can't match what every educator does. So that's why we go through and do things that way, ask questions differently. One of the things I found the most exciting by taking the registry is like in multiple response. I read every question twice. Took me a minute per question. It took a long time. Multiple response. I read it twice. I'm like, all right, what I think the two things would be is this. And the registry gave me one of those things, but it didn't give me the other one I wanted. There was a way that it was phrased in the other one that was correct, but it didn't hand it to me the way I wanted. And that's the thing I learned. Now, when I write multiple response items, I try and make them so they're not, which of the following are components of the primary assessment? Airway, stopping bleeding, and then three other things, right? No, you've got to make it a little bit more challenging. So it's not rote. I am not going to comment on other people's products. I don't think that's becoming for a company and do that. I do think it's fair game. Jeff Anderson from Louisiana, there's a paramedic faculty Google group out there. And granted, it's paramedic faculty, but a lot of paramedic faculty, have EMT things. I highly recommend getting in that group. I find it very insightful and some really great people on there that are willing to help you. So if you just Google paramedic faculty Google group, or listmedic@gmail.com. Sorry, Jeff, if you get bombarded. One word, listmedic@gmail.com, and get on that list. It's a good place to ask those questions. I don't want to not answer. I have an opinion what I do as an educator, but Limmer Education tries to be there for you. We always try and keep above the fray. Yeah, totally take the test. What I don't know is if like I'm a paramedic and I don't think I can take the EMT test. I don't think the National Registry just lets you take tests willy-nilly. There's security and other things. But my paramedic test had about 30% BLS questions. I could have easily been on an EMT exam. So go back and take it to research. Just go do it that way. It's worth it. Huh. It does. I bet it does take some doing. I'd love to take the EMT test. All right. I think that we are right now at the 1 hour mark. I think it's a perfect time to call it. But you can always get me, Dan at limmereducation.com, or the company at support@limmereducation.com. We want to be here for you. Yeah, we want to get our products into your hands and your students' hands, no doubt about that. But we also want to be here for you. We want to continue to do these things that we believe help you, to give you the resources as educators, and like I said, to be here for you. Boy, Limmer Education, that chat is right on the money. All right, I'm gonna call it for that. I'm gonna mute here, but you guys can still chat for a little bit. And I want to thank you for coming. This is outstanding attendance, and I'm really glad. And I know people are going to watch this offline as well. So please reach out to us if we can help. Limmer Education is here for you. And this new exam, you're going to be okay.